Will the reforms to the NHS do enough to prevent serious failings in care, such as those at Stafford Hospital?
Will the reforms in the NHS do enough to prevent serious failings in care? Ollie Grennan.
Well, so this week what the government has done is published some responses to the Francis report into mid-staffs. And I'm sure that Jeremy Hunt will go through quite a few in detail, but I'll just look at one in particular, which was actually in the Lib Dem manifesto, and it is about a duty of candour. Now, I see this as incredibly important. This is about honesty from people. When I hand my child into a nursery, I expect all the staff to be absolutely straight with me if anything has gone wrong. And it's exactly the same, you know, kind of as an elderly relative goes into a hospital, you want to know that there's an absolute expectation on both the organisation and the individuals in the organisation.
Yeah, but that goes without saying. But how will what happened at Stafford Hospital be prevented?
Unfortunately, it doesn't go without saying, and it hasn't happened.
It goes without saying that you think that should happen, but the question is whether the reforms that Jeremy Hunt has introduced will prevent it happening in future.
Well, I think that's just one example of one of the reforms that will prevent things like this in the future. And, you know, I'm kind of confident that that will happen. I think, in a way, that what we need to do is start celebrating the whistleblowers. And, you know, this is exactly the kind of thing that we expect. We want people to be honest when something has gone wrong. And this is exactly what didn't happen in mid-staffs. So I'll just say, on this one particular point, but there's 77 other recommendations, yes, I have confidence. I have confidence in the others as well, but I think
we better not list the other 70 or 280 or whatever it was. You on the right there.
So one of the reforms is going to criminalise nurses and doctors for willful neglect. Will that create a culture of openness within the NHS or a culture of fear?
Jeremy Hunt. Specific point, if you would.
Yeah, I mean, one of the shocking things about what happened at Mid-Staffs Hospital was that no nurses and doctors were brought to book for a very long time. In extremis, I think it is right if someone deliberately harms a patient. Lots and lots of doctors and nurses have spoken up in favour of this and said they wouldn't want a doctor who deliberately harms a patient not to meet the full force of the law. What sort of doctor or nurse would ever disagree with that? But that actually isn't the heart of the change, because the heart of the change is something different, which is actually doing what Ollie was talking about, making it easier for people to speak out by giving them protection in their professional codes that they haven't had before. And I meet a lot of nurses and doctors who see things that they worry about, but then think, what will happen? What will happen to my career? What will my boss say if I speak out? We need to change the culture so that everyone understands that we all want people to speak out.
But her point was about criminalising.
Yeah, well, that I think will happen in a very small
happy with his answer
minority of cases.
Does that answer your point?
No, well...
What's your worry about it?
That by criminalising people, that other people will instead be scared to criminalise their colleagues. And that actually it will be contradictory.
In other words, they won't whistleblow, you think, if they think they'll get charged with criminal offence. You, sir?
Yeah. In order for that duty of candour to really work, it depends on the culture of the organisations, as you've said. And it really does depend on that going from the top throughout the organisation. Otherwise, a blame sort of culture enters. So what we're wanting, and it is different, I agree with you, that it's different, those prosecutions, those are slightly different because those are where harm has been done deliberately. But where it's a mistake, then we've got to have it so that staff will be able to put their hand up and say, look, I've messed up on this, I'm sorry, we've got to put it right, but also we've got to learn from it. And it's that culture of learning running through the organisations that I think will make the big change.
Okay.
Just on the point of criminalising neglect again, I'm going to qualify as a doctor in a couple of months' time. And I'm just wondering, why is it OK for other professions, when they make a mistake in their job, not to face incarcerations, but it's a completely different story for medical professionals? Why is that the case?
Yes, that's true. Well, that's not true. If you deliberately harm anyone in any profession or in any walk of life, you're subject to law. Actually, this is just changing something that was in common law and putting it into statute. But I actually think this gentleman's made the point that's absolutely right. This isn't about trying to create more criminals. It's actually trying to create a culture of openness. And you have here one of the best hospitals in the country, Salford Royal, which is the safest hospital outside London. And they've done that because they have a very inspiring chief executive and a very inspiring chief nurse who have created a culture where the staff feel able to speak out. And that's because they think that if they talk about an error, something's going to happen, someone's going to learn from it, they're not going to be penalised for it.
There's also another in Greater Manchester, which is Greater Manchester West Mental Health Hospital Trust, where I happen to be on the board there.
Good, well, that's fair. And actually, there's the Wythenshawe. There are lots of great NHS organisations in Manchester. But...
Okay. Sadiq Khan.
Well, can I say, look, I think the Francis report is a very good report. Unlike Ollie and Jeremy, I think we should implement all of the recommendations in full. And I think one of the problems with Jeremy, and Jeremy talks a great talk, is actually the evidence is since his party joined a coalition government with Ollie's party, the number of nurses, and Jeremy, my source is the NHS Information Centre today, the number of nurses is down by 6,642 since May 2010. What is one of the main findings of Francis? That staffing levels were so low, doctors and nurses led to inadequate care and led to bad things happening in mid-Staffordshire. My worry is this, Jeremy. You can have a criminal law about willful neglect and you can publicise the ratio of staff on wards, but unless you give these hospitals the resources and the nurses, it's all talk and no action. And that's what needs to happen, Jeremy.
Yeah, well, let me respond to that. Because here are the figures that are equally robust that you didn't mention, which is that over the last 3 years we've actually had 6,600 more doctors in the NHS. We've got 1,200 more midwives. We've got 1,000 more health visitors. And yes, I am worried about the nurses going down. They haven't gone down in hospitals, actually. They've gone up, but they've gone down in the community. District nursing numbers have gone down. That is wrong, and that is why we are making the changes we're making this week, which means everyone has to publish the number of nurses they have so that we know if there's safe staffing. And as a result of these changes...
if they're too low.
If I can just...
We'll give them more resources if they're too
low.
low.
You don't actually really have anywhere to go because your party opposed a public inquiry into what happened in Mid-Stats.
Political point.
But it's true. You didn't want to have the inquiry that we had.
You started Francis.
No, you asked him not to interrupt you.
Yeah, it is true. Andy Burnham decided not to have a public inquiry, and we decided to have it. And that's why we're adopting so many of these recommendations today. And what has happened as a result of that public inquiry that you didn't want to happen? Over the last year, our hospitals have decided to recruit 4,000 more nurses than they were planning to do 12 months ago. So I think the climate is changing. I completely agree. We've got to have safe staffing in our wards. But it's not about one number for all the wards. Actually, it's about what happens on a ward-by-ward basis. It's about transparency, and it's about people feeling comfortable to speak out when they see something that's wrong.
The woman here on the left.
Several years ago, the NHS carried out one of the biggest job evaluation exercises in Western Europe. During that job evaluation exercise, many nurses were removed from nursing grades and put onto management grades. And that's why a lot of nurses disappeared on the face of it. Now, a ward sister isn't a ward sister anymore. She's called a ward manager. So she's not counted in the nursing numbers. And
so you think the numbers are understated?
So I think we may not have lost that number of nurses.
Right. And up there, the man up there in the checked shirt.
You can talk about statistics all night. There's always two sides to every argument. But the question was about whether the reforms that the government are implementing are actually going to help. And one of the root causes that the Francis report said about Stafford Hospital was that it was because the management there were pushing to meet the government's targets and to try and get foundation status. That was why they were ignoring patients. They were more concerned about meeting their targets and getting foundation status so they had independence than they were about the patients. So the question is these reforms going to help? Would we not be better like removing politicians from the NHS, no offence intended, sir, by one step, so that there can't be this constant reorganisation and changes going on, because that's what's causing all the problems at the end. It's management.
Well, remove the politicians altogether. Very briefly, we've got to go on to another point.
It's also about ensuring that the care is wrapped around the individual. And so that's why the care bill that's currently going through the House of Lords is so important, because it breaks down all these different, if you say politically led or however, institutions, and instead it places them wrapped around so that one person gets the kind of dignity, attention, care and personal attention that they need. And that is the foundation of a bill that we're taking through the House of Lords at the moment.
Can I just very briefly say, I think you are absolutely right. The definition of success for a good hospital before was meeting your waiting times targets and being in financial balance. And we have set up this year a new Chief Inspector of Hospitals who is going around, and it will not be possible to be a good or outstanding hospital unless you have good or outstanding compassionate care.
Very briefly.
That is a big change.
Very briefly.
To answer your question directly, I mean, patients need to be at the heart of what all hospitals do. I've got to say this, though. I mean, Jeremy talks a good talk again, and I know Jeremy doesn't like me mentioning figures, but patients, if they're at the heart of things, it means not waiting more than 4 hours for A&E. It means not lying in your trolley waiting for treatment. It means not being in an ambulance queuing up to get in. It means when you're an elderly patient, not waiting for days in the hospital rather than being at home. And that's the problem with the government's £3 billion wasted on a reorganisation nobody wanted.